Hello, Dr. Marzir again, and in this video we will talk about the key features of the back, and at the end we will have 11 review questions. If you have any question, you can email me here at amar@goodrational.com or comment your question down below. Here are our objectives or key features: the long vertebral column and short spinal cord, intervertebral foramina and spinal nerve, and the innervation of the back, cutaneous part. First one, long vertebral column and short spinal cord. During development, the vertebral column grows much faster than the spinal cord, and as a result, the spinal cord does not extend the entire length of the vertebral canal. Here's the vertebral canal, and here's the spinal cord. It does not extend the entire length. In adults, normally the spinal cord ends typically at level of between L1 and L2. However, it can end as high as T12 or as low as between L2 and L3, but typically between L1 and L2. Here is the spinal nerves, and the spinal nerve roots are inside, and here is the spinal cord and nerve roots just inside the canal, and here is the spinal nerves exiting. Now the spinal nerves originates from the spinal cord at increasingly oblique angles. The cervical one, as you can see, is at the same level of the vertebra. This is the most horizontal, and when we come to the coccygeal, it's the most oblique. As you can see here, most horizontal and more oblique as it's coming downwards, as we come downwards. Okay, and also the nerve roots pass in the vertebral canal for increasingly longer distances. As you can see, the spinal cord ends here, but how come the sacral and coccygeal spinal nerves exiting from these foramina? They must travel longer distances. So here is the short distance at level of C1, and here is the longest distance, the coccygeal. And therefore, the spinal cord level of origin becomes increasingly dissociated from the vertebral column level of exit. This is particularly evident for lumbar and sacral spinal nerves. Let's talk about the intervertebral foramina and spinal nerves. Here is the spinal cord, here is the spinal nerve, and here is the foramina, intervertebral foramina. Each spinal nerve exits the vertebral canal laterally through this foramina, intervertebral foramina. This foramen is formed between adjacent vertebral arches, as you can see here. It is closely related to intervertebral joints. Superior and inferior margins of intervertebral foramen are formed by notches in adjacent pedicles. Here is superior, here is inferior notch of the vertebra above, and here is a superior notch of the vertebra below. Now the posterior margin is formed by articular processes of vertebral arches and the associated joint. And this joint is called zygapophyseal joint. The anterior border is formed by the intervertebral disc between the vertebral bodies of adjacent vertebrae. Now, any pathology that occludes or reduces the size of this foramen, such as bone loss, or herniation of the disc, or dislocation of the zygapophyseal joint, can affect the function of the associated spinal nerve. Bone loss, herniation of the disc, and any dislocation of the joint. Lastly, let's talk about the innervation of the back. We have discussed that anterior rami of spinal nerves innervate the extrinsic muscles, superficial and intermediate, but the intrinsic muscles are innervated by the posterior rami of spinal nerves, and also the posterior rami of spinal nerves also innervate the cutaneous parts of the back. So the posterior branches of spinal nerves innervate the intrinsic muscles and the adjacent skin, and the cutaneous distribution of these posterior rami extends to the gluteal region of the lower limb and the posterior aspect of the head, as you can see. Here is parts of the dermatomes innervated by the posterior rami of spinal nerves shown here. Time for questions. Please take your time and answer in the comment section down below. Question number 1. The most oblique spinal nerve is? C1, L5, coccygeal, S5, or T12. The most horizontal spinal nerve is. In adults, spinal cord typically ends at the level of. In adults, spinal cord can end anywhere from which to which vertebrae. The longest nerve roots are. The shortest nerve roots are. Spinal nerves that are most associated from their vertebral column level of exit are associated. Spinal nerves that are most dissociated from their vertebral column level of exit are. Superior and inferior margins of intervertebral foramina is formed by. Which answer? The posterior margin of intervertebral foramina is formed by. Last question. The anterior border of the intervertebral foramina is formed by. Lastly, if you like this video, please subscribe and hit the like button to keep me encouraged and keep uploading. Thank you.